Hey, good evening, everybody. We are actually going to get started right on time here. I wanted to welcome you to the annual Alumni Learning Series. My name's Todd Stankiewicz. I am the president of the UIC School of Health, Public Health Alumni Association. And I'm on the board here. And we started this learning series about 5 years ago. And we've kind of morphed it over time. And this year is going to be very special. And I think we've got some very special guests that you'll hear about in a little bit. But we always have to do a few announcements ahead of time. One, just take a look around you where the exit signs are. And then they're pretty clear down the hallway, and there'll be meeting points outside. Also, the restrooms are out the door and to the left. And most importantly, if you're going to be asking any questions tonight, which we're going to strongly encourage, there is a mic over to my left and your right there that we would like you to use. It's really so everyone can hear it. There is an overflow room as well down the hall, so it just makes everything a lot clearer for everybody. So, let's get on to the Alumni Series. It's not only a way to engage our alumni, but community members and others who care about public health issues. This year's event is different from the past in that we are collaborating with many community and campus partners. I really want to note that the group here in the Office of Advancement, Emily Pesteris and Grisel Torres, worked very hard to bring the speakers you see up here to us tonight. They worked tirelessly on that, and because it's such an important issue. But I would also like to thank our event sponsors, Rush University, the Center for Health Equity Research Chicago, Institute for Research on Race and Public Policy, Health and Medicine Policy Research Group, and the Public Health Student Association for your generosity in helping us host this event tonight. In that spirit, I will turn it over to Dr. Torres and have her do the honor of presenting our distinguished guests. Enjoy the evening.
So I'm going to stick to the script because then I go off track all the time. Welcome, everybody. My name is Grisel Torres, and I am the Vice President of the UIC Alumni Board. And I get to do the honors to do the introduction because I really had to hustle to kind of pull this stuff together. I had to barter, I had to trade services, I had to beg for money, you name it. So this year, we are thrilled to have Dr. Camara Jones, Dr. David Ansell, and of course, the legendary Dr. Linda Ray Murray, as part of this whole panel discussion to bring attention to racism as a public health issue at the national level and of course at the local level and what that means to us. So let me start by giving you some background on the distinguished panel members. Dr. Ansell is a general internist and is currently the Senior Vice President for the Community Health Equity and Rush University Medical Center, Associate Provost for Community Affairs. Wow, that's a mouthful. His research focus has been on access to care and healthcare inequity and its relationship to quality. In 1983, he began the breast and cervical cancer screening program at Cook County Hospital and is currently board chair of the Metropolitan Chicago Breast Cancer Task Force. If you haven't done so already, I encourage you to check out his most recent book. Well, I encourage you to read first The County, and then read The Death Gap, his recent book on how inequality kills. Next is Dr. Linda Ray Murray, is the Chief Medical Officer for the Cook County Department of Public Health, practicing as a general internist at Woodlawn Health Center, attending physician in the Division of Occupational and Environmental Medicine at Cook County Hospital, and an adjunct assistant professor here at the UIC School of Public Health, and she claims she's retired. Dr. Murray is an active member of a range of local and national organizations, including the Board of Directors and the Board of Directors of Trinity Health and the National Advisory Committee on Occupational Safety and Health. And now, what many of us have been waiting for, is my pleasure to introduce Dr. Camara Jones. Dr. Jones joins us from Atlanta, Georgia, where she's an adjunct associate professor at the Morehouse School of Medicine and a senior fellow at the Satcher Health Leadership Institute and Cardiovascular Research Institute. Dr. Jones is a family physician, an epidemiologist whose work focuses on the impacts of racism on health and well-being of the nation. She seeks to broaden the national health debate to include not only universal access to high-quality health care, but also attention to the social determinants of health, including poverty, and the social determinants of equity, including racism. No more further ado, Dr. Jones.
So, no, what Dr. Jones decided not to use slides, yay. We want this to be very conversational. We're going to start with Dr. Jones and Dr. Ansell. We'll start with Camara, and David's going to make it more local.
Can we call you Lisa?
You know, this is March, which means technically Black History Month is over with. But like they say, I'm Black 365. So I wanted to remind us that this is an important year. This is the 200th anniversary of the birth of Frederick Douglass, an important event in our nation's history. It also happens to be the 150th year of the birth of W.E.B. Du Bois. And in this time period, I think it's important that we remember him. And I am in the middle of rereading Black Reconstruction, one of his seminal books. But in honor of this important anniversary, they have reissued Souls of Black People with a new introduction. I encourage you all to pick that up and pay attention because unfortunately, not a lot has changed. We're gonna be talking about racism tonight and what we should do about it and how we can end it. And I think it's appropriate that we remember the history of where we come from. It really wasn't until 1924 that all Native Americans were considered good enough to be citizens. They sort of leaked in bit by bit. And today, actually today, March 1st, 50 years ago, the Kerner Report was issued. Some of you young people might not remember it, but hopefully a bunch of folks with gray in their hair remembers reading it. This report was commissioned. It was made up of 11 men, all of whom were white except for Roy Wilkins, who at that time was a leader of the NAACP, and Ed Brooks, again for you young people, for many years the only Black Republican senator in the country. But everybody else was a white man, and they went around and studied this problem. You should get it out the library and look at it, but since that report, 50 years, poverty has gone up, inequalities have gone up, almost any way you measure them. In 1988, almost 50% of all Black children went to school in schools that were majority white. I'm not sure if that's good or bad, that's just a statistic. Today, that percentage has dropped to 20%. So clearly, if we're looking at school segregation, we've moved backwards. In terms of our local schools, CPS, in 2000, the number of Black teachers was much higher than it is today, about almost twice as high as it is today. The number of Latino teachers has risen, but it's still way below the number of Latino students. So I guess one of the things that we need to be talking about collectively is how did we get here and how the hell do we get out of this mess? So let me turn it over to Camara.
Oh, for the answers? Thanks. So I want to say, first of all, this is so important that we're doing this, that we're talking about racism. When I was the president of the American Public Health Association 2 years ago, I launched APHA on a national campaign against racism, inviting as many partners and communities as would join us. And that effort is still unfolding, it's still budding, it's still bearing fruit. When I said a national campaign against racism, really there were 3 tasks. One was to name racism, to say the word, not just to say race or disparities or disproportionality or implicit bias or unconscious bias or diversity and inclusion. Those are all very important things to talk about. But we also need to say the word racism to get the ism out, right? When we're talking about racism. So that's the first task, and I'm going to give you some tools for doing that. without having people immediately react as if you called them racist. I mean, some people are racist, and so maybe we can call, but when I talk about racism, I'm going to be talking about a system. The second of the 3 tasks of a national campaign against racism is then to identify how is racism operating here, in my school, in my child's school, in my workplace, in this city, in this country, in the world. So I'm going to give you some tools for thinking about how to answer that question. It's an important question because if we name and document all day long but do not identify levers upon which we can intervene, we've done nothing. The third of the 3 tasks is then to organize and strategize to act. Because addressing racism is going to require collective action from all of us. So with all of that said, I'm going to start with sharing one of the allegories that I've developed for talking about issues of race and racism. This one I call Dual Reality, a Restaurant Saga. And it was sparked by my real-life experience of being a medical student studying with some friends in my apartment one weekend, and we were studying long and hard, and it got late, and we got hungry, and I had no food in the apartment. So we decided to go into town and try to find something to eat. So we go into town and we find a restaurant and we walk in and we sit down and the menus are presented. Actually, I use my hands so much in storytelling. I'm going to see if I can get a good sound this way still. Can you hear me still? Is it all right? Okay. So we went in, we sat down, the menus are presented. We order our food, the food is served. Like it sounds regular, right? I hope that many of us have had this experience before. But as I sat there eating with my friends, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now you're very interested. Dr. Jones, what did the sign say? Well, what the sign said was open. So I know that I've lost many of you. So let me recap. Here we are, sitting in a restaurant, eating. I look up, I see a sign that says open. If I hadn't thought anything more about it, I would have assumed that other hungry people would walk in, sit down, order their food, and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, because of the hour, the restaurant was indeed closed. And that other hungry people just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food, and eat. And that's when I understood that racism structures open, closed signs in our society. Racism structures a dual reality. And for those who are inside the restaurant, sitting at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on because it is difficult for any of us to recognize a system of inequity that privileges us. It is difficult for men to recognize male privilege and sexism. It is difficult for white Americans to recognize white privilege and racism. It is difficult for all Americans to recognize our American privilege in the global context, except we got a little taste of that with Ebola, did we not? Yet those on the outside are very aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who say, is there really a two-sided sign? Does racism really exist? I say I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism, it's an empowering thing. It doesn't even compel you to act, but it does equip you to act so that if you care anything about the people on the other side of the sign, which is an if, but if you do, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door again and let them come in? You'll make more money, and oh, the conversations we can have. Or maybe what you'll do is pass food through the door. Or maybe you'll break the glass, or maybe you'll try to tear down that sign. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So I use that story to help people understand that, yes, racism does exist, even if your parents never talked to you about it, right? that this is something real going on. It's a structural thing. So let me now define racism. When I say the word racism, I am clear that I'm talking about a system. So I'm not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested, even though those things are the result sometimes of racism. But when I'm talking about racism, I'm talking about a system of power. And it's a system of doing what? It's a system of both structuring opportunity and of assigning value. And on what basis is the opportunity structured, and on what basis is the value assigned? It's based on the social interpretation of how we look, which is what we call race in this country. I just give you myself as a little quick example. Here in Chicago, you look at me and I am clearly black. But I have experienced that in some parts of Brazil, you look at me and I'm just as clearly white. In South Africa, you look at me and I'm just as clearly colored. Here I am, same physical appearance, but the social interpretation of my appearance, those three settings, would assign me to three different racial groups. And furthermore, if I were to stay in any of those settings long enough, then my health outcome would become that of the group to which I've been assigned, even though I'd have the same genes in all three places, right? So this is what race is, the social interpretation of how one looks in a race-conscious society. And every one of us in this room, and in other rooms, and streaming, and whatever, however you are looking at this, every one of us, there's some other place on earth where we would have a different so-called race than what we have here today. And if race is the social interpretation of how we look, then racism is the system that operates on that to structure opportunity and assign value. Now, what are the impacts of this system of structuring opportunity and assigning value? Well, when we do as a nation understand that racism is alive and well and having bad impacts, we go to the fact that racism unfairly disadvantages some individuals and communities. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities, and that's the whole issue of unearned white privilege that we hardly ever talk about in this country. And the reason we hardly ever talk about it is that it makes some people, especially some white people, uncomfortable. And actually, you know, for the past few months, I've been thinking explicitly about abandoning a commitment to white comfort. We, you know, we in this nation, right? We in this nation have valued white comfort over history, white comfort over truth, white comfort over equity for too long. So I'm not trying to make anybody uncomfortable. I hope that already my little dual reality has made some people more comfortable thinking about racism really existing. But if you do feel uncomfortable, I just ask you to shake it off and let's keep on in the conversation, okay? So now we have described two impacts of racism, the unfair disadvantage and the reciprocal unfair advantage. But there's another impact of racism that many of us do not really understand, and that is how racism is sapping the strength of our whole society through the waste of human resources. And we have many examples of that. A very prominent one is how we as a nation are not vigorously investing in the full, excellent public education of all of our children, because the blinders of racism are some of those in charge. Those blinders of racism that don't value all of us make people think that there's no genius in the barrios or the reservations or in the ghettos. You know, we can get along very well, thank you, without those kids, is the belief. But of course, there's genius in all of our communities. And if we were to only vigorously invest in that genius, we could be doing so much better as a nation, or even as a world. And sometimes I say we might even already be up on Mars farming if that were a good idea, if we were to invest in all that genius. And then I'm reminded that we wouldn't even have to go to Mars. We could be solving the problems in our communities today if we were to invest in all of that genius. Another very important way that racism saps the strength of the whole society is how these same blinders that don't value all of us equally have made us as a nation complacent with what I describe as the wholesale warehousing disproportionately of so many black and brown men in our prison system, as if that did not separate us from human potential. And if you know people who are either stuck in the prisons or cycling in and out, because if you come out with a felony conviction, it's hard to get a job. It's hard to get housing. In many states, you can never vote again, right? So we have to interrupt the disproportionate incarceration, and we have to interrupt the cycling and out. We need to provide our returning citizens with job opportunities and education and the like. But getting back to what I was saying, if you know any of the people caught up in this system, then you know firsthand that there are many geniuses stuck away in this system that if there were only some other way could be contributing quite productively to our society. And in fact, of the three impacts of racism that I described, the unfair disadvantage, the reciprocal unfair advantage, and how racism is sapping the strength of the whole society through the waste of human resources, I think that last point deserves a whole lot more attention now. And so I would say, I know all of you guys are alum, but as alums, you're still out there, you know, doing work and all like that. We need more research, data, evidence on that. We need more media stories on that. We need more conversations around our dinner tables about how racism is sapping the strength of the whole society so that we can get more people filled with a sense of urgency, if you will, to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. Before I leave this definition of racism, I guess I'm going to say two things about it. First of all, when I say racism is a system, that actually is it's a soft way for me to start talking about racism. It's a way that I use because it's clear then that I'm not going in trying to divide the room into who's racist and who's not, right? Because racism is a system that's affecting all of us in different ways. My racism is mostly internalized racism, but it's affecting all of us. Actually, I think that understanding racism as a system, I start using this idea of racism as a cement factory spewing cement dust, and if you're anywhere near that factory for even a little while, you will have cement dust in your lungs, right? All of us will have different aspects. It'll affect us differently, but we'll have cement dust in our lungs. And if you recognize that there's a cement factory spewing cement dust and you don't want cement dust in your lungs, you're going to have to put on a gas mask. That is, you're going to have to become actively anti-racist. But then you're not just trying to do that without telling other people about the factory. So you got to name racism and tell people there's something going on and encourage them to put on their gas mask. And then when enough of us are equipped with a gas mask, then our job is to go into the factory and shut it down. So I am not blaming anybody for having cement dust in their lungs. I only blame you if I tell you about the cement factory and then you choose to carry on as if nothing is the problem, right? Especially if you're profiting from that cement factory and the spewing of cement dust. So that's the first thing, is that my definition talks about racism as a system. The second thing is, when I was at the CDC, for 10 years, I was in a part of the CDC where I was working on racism and health, and that was all good. And I moved to another part of the CDC, and they were not so interested in CDC talking about racism at all, much less if CDC was going to deal with racism at all, it shouldn't deal with it in their division, right? And so I had somebody clearing my presentations who, when I have a slide and I talk about those three impacts of racism, the unfair disadvantage and then the unfair advantage and the sapping the strength, that person told me I needed to stop talking about unfair advantage. I needed to take that off of my slide. And the compromise we came to for a moment was, well, as long as I took the word unfair off, I could talk about disadvantage and advantage as long as I didn't characterize any of them as unfair. What I understood from that interaction is this. There are many people in this country who think that there is disadvantaged and normal. Disadvantaged and normal. And the reason that there's so many people who think that is that we are ahistorical as a nation. And people do not understand that their so-called normal is built up on a whole mountain of unfair advantage. Thank you. Now, I want to ask a question, which is, I know all of you guys are alumni or friends of alumni. How many in this room have never, ever heard the Gardener's Tale? Raise your hand high. Ah, okay. So I'm going to use the rest of my time to tell the Gardener's Tale.
It's always good. I like hearing it over and over.
Well, I would say for those of you who have heard it, I encourage you to listen now with different ears, right? Listen to the nuances of the storytelling so that you can confidently tell the story back. But for the others of you, first I require some background, because this Gardener's Tale allegory is a story that helps to illustrate 3 levels of racism, which I sort of used to help me understand how could racism turn into a health outcome? How could racism turn into differences in asthma prevalence between populations, or obesity prevalence, or differences in infant mortality rate or maternal mortality rate? How does that happen? And so I like to understand it on 3 levels: institutionalized, personally mediated, and internalized. I'm going to very briefly give you definitions and key characteristics of each of these levels and then tell you the story. Institutionalized racism is the system, if you will. It's the constellation of structures, policies, practices, norms, and values, which are actually the elements of decision making, right? But it's this constellation of all this system stuff, the structural racism, if you will, that results in differential access to the goods, services, and opportunities of society by race. This institutionalized racism is the kind of racism that does not require an identifiable perpetrator because it's been institutionalized in our laws, customs, and background norms. It shows up as the inherited disadvantage or the reciprocal inherited advantage. We see it in terms of material conditions and in terms of access to power. So, for example, differential access to quality housing by race, or equal educational opportunities by race, or equal employment opportunities, or even the same level of income at the same level of employment. Those things are part of institutionalized racism, and that clearly impacts health. Differential access to medical facilities, including linguistic access, differential access to a clean environment. In terms of power, differential access to power as information, so it could be health information or even information about our own histories. Differential access to power as voice in government, media, and the like. Now, when I am doing talks and I have slides behind me, people get to see these words, and sometimes people say, excuse me, Dr. Jones, I see you have that, education, occupation, income, wealth, housing. Isn't that what we call social class? Why do you have that on a slide about racism? Are you talking about racism, or are you really, really talking about social class? So I just want to address that question for a moment and say that my answer starts with the observation that it doesn't just so happen that people of color in this country are overrepresented in poverty while white people in this country are overrepresented in wealth. That is not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical injustice. And so, for example, for American Indians, it was the taking of the land, the near genocide, moving of the survivors to reserve lands. For many, many different groups, when I have a whole lot of time, I talk about, Mexicans who never crossed the border crossed them, and they're now in New Mexico, but their grandchildren, great-grandchildren are being harassed. I could go through a whole litany of Chinese, Japanese, all. And I end up talking about people of African descent, where the initial historical injustice was the kidnapping of West African people and our importation across the Atlantic with tremendous loss of life in the Middle Passage, and then for the survivors and their progeny for generations, what I describe as the coerced usury of our unpaid labor for centuries to build this country. And that's when people say, oh, Dr. Jones, excuse me, there you go talking about slavery. We all recognize that slavery was an unfortunate chapter in our nation's history, but Dr. Jones, the enslaved people were emancipated by 1865, and we are now in 2018, so that makes that 153 years ago. So Dr. Jones, all else being equal, don't you think the impacts of slavery would have washed out by now? But the key phrase in their question is all else being equal. And all else has not been equal since 1865, and all else still is not equal today, and there are what I describe as contemporary structural factors, present-day structural factors that are perpetuating that and each of the other initial historical injustices that I have described. And those contemporary structural factors are part and parcel of institutionalized racism. So when somebody asks me, are you talking about racism, or are you really talking about social class, my answer is that institutionalized racism explains why we see an association between social class and race in this country, and that's an important aha. Institutionalized racism can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission, and very often it shows up as inaction in the face of need. The second level of racism, what I call personally mediated racism, other people call it interpersonal, but I'm still understanding racism as a system, so this is the system mediated through people, so that's why I use that very convoluted term, personally mediated racism. My definition of that is differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. This is what most people think of when they hear the word racism. Somebody did something to somebody else. It includes the different idea, the prejudice, and the different action, the discrimination. And we can see it in terms of police brutality, physician disrespect, kind of the microaggressions of shopkeeper vigilance following you around the stores, or waiter indifference, teachers sending young kids off to the ADD track where they won't even know their full potential, much less have the opportunity to develop to their full potential. And the key thing here is that personally mediated racism can be through acts of doing as well as acts of not doing, but more important is that it can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism, internalized racism, I for a long time spoke about only from the point of view of members of the stigmatized races. So my definition there is acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. I say I used to only think about it from that point of view because actually, I have friends who do anti-racism training who ask me, what about the internalized sense of entitlement that many white people walk around with? Isn't that also internalized racism? And indeed it is, but I never really thought about how that sense of entitlement could turn into bad health outcomes. Except now I'm thinking that entitlement thwarted might turn into opioid abuse, or it might turn into suicide, or it might turn into voting against your own interest, or however, it's manifesting. Right? But back from the point of view of stigmatized folks, it turns into self-devaluation, feeling maybe I'm really not as good as, maybe I shouldn't try to graduate from high school or go to that college. The white man's ice is colder syndrome. Maybe your parents you've heard that from your parents. What it meant for people of color, back in my parents' generation, it still means for many of us today. So for example, say I'm black and I need a lawyer. You know what? I might seek out a white lawyer over a black lawyer. Or if I'm sick, I might prefer the white doctor over the black doctor. And in fact, if my water was warm, I might go way down the street to get the white man's ice over the black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. So it turns into resignation, hopelessness, helplessness, a lot of self-destructive health behaviors. It's about accepting the limitations to our full humanity of the box into which we've been placed. So here's the story. The story, this is another one sparked by my own real life experience. Do I have time to tell the real life experience in the stories? Yes. You're gonna make time. Thank you.
You got my time.
Okay, thank you. So this was sparked by my experience when I was now married about a year. I was going to go back down to Hopkins, finish my PhD, and my husband and I bought our first freestanding house. Cute little house, big wraparound porch with flower boxes dotted all on the porch. And we bought the house in October, so that really wasn't the time for us to plant. So we waited, but when spring came, my husband, who loves to garden, ran out with our marigold seeds. He's going to decorate our cute little porch. And then he came back and he said, well, you know what? Some of our boxes have dirt in them, but some of the boxes are empty. Let me go down to the gardening store and get some potting soil. So he went to the gardening store, and he hauls back big old bags of potting soil. And then we fill up the empty boxes. And then we put equal numbers of the marigold seeds in all of the boxes, and we water them. And I'm really not the gardener in the family, so at this point, I'm just going to sit back. I'm exhausted, right? I'm going to sit back and just enjoy. Well, 3 weeks later, as I'm walking out of my house, I passed these flower boxes and looked at them, and I literally stopped in my tracks because what I saw in the flower boxes on my porch made me think that we had planted completely different species in some boxes versus the others, because some of the boxes were full of plants. And in those plants, many of them were strong and vigorous looking. And other boxes just had a few plants in them, and they were scrawny and scraggly looking. And then I realized what had happened. That potting soil that we bought turned out to be rich, fertile soil, so that every single seed planted into the rich, fertile soil sprouted. The strong seed grew very tall and vigorous, and even the weak seed made it halfway up. But that old soil that we had found there turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil just died. And even the strong seed planted in the poor, rocky soil had to struggle to make it to a middling height. And I see a few of you guys nodding out there. So maybe you all have composted half of your garden, right? And maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. But now I'm going to take this image and I'm going to make it a story about racism by introducing a gardener. So now we're going to have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, and one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, And some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed and she puts it in the rich, fertile soil, the pink seed in the poor, rocky soil, and 3 weeks later she sees in her boxes what I saw in mine. In that rich, fertile soil, all the red seed sprouts, strong red seed grows tall and vigorous, and even the weak red seed makes it halfway up. In that poor, rocky soil, the weak pink seed dies. And here comes a strong pink seed struggling to make it to a middling height. And then in those 2 flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, the same thing happens until finally, about 10 years later, the gardener's looking at her flower boxes and she says, you know, I was right to prefer red over pink. So we're going to interrupt the story there for just a moment to say this first part of the story is how institutionalized racism works, where you have the initial historical injustice of the separation of the seed into the 2 types of soil. You have the contemporary structural factors of the flower boxes, keeping the soil separate, and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up to say, well, where is personally mediated racism in the garden? Well, the gardener's looking over at red thinking, oh, red is so beautiful. And then she looks at the pink flowers and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them either not understanding or acknowledging that they're benefiting from enriched soil. The pink flowers are looking over at red thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, but they're collecting nectar, but they're pollinating at the same time. So here comes a bee into one of the pink flowers, and then to another pink flower, and to this flower, and this pink flower says, get away from me, bee, do not bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers and we can say, pink is beautiful, power to the pink. And that is an important intervention. I'm not making light of that as an intervention, but if that is all that we do, it's not going to change the situation in which the pink flowers find themselves. So you say, okay, let's address the personally mediated racism. Let's have a conversation with the gardener. Or better yet, let's have a workplace multicultural workshop for the garden, right? It's all good. So we have our little workshop, big workshop. Workshops are good. You know, we've got to name racism, right? So we have our workshop. In the workshop, we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will and maybe she won't, right? But even if she does, it's still not going to change the situation in which those pink flowers find themselves. If we really want to set things right in this garden, we need to address the institutionalized racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it makes it easier for the gardener to continue segregating resources going forward. But if you keep separate boxes, what it means is you need to enrich that poor rocky soil until it is as rich as the rich fertile soil, and when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. And you know, sometimes I say this and sometimes I don't. I'm going to say it tonight. I'm brave, right? You know those pink seed have been selected for survival and strength. So when you enrich that soil until it's as rich as the rich fertile soil, they might even look a little bit better than the red, okay? I used to always say that, and then I stopped. You know why? Because that's the fear of many people. And I guess that's my little tip of the hat to white comfort, right? But anyway, but let me carry this story on. Oh, I can't believe okay. So let me just finish the story. So when you enrich that soil and the pink flowers are as beautiful as the red, you'll also have addressed the internalized racism, because pink won't be looking over at red, thinking red is better or wanting to be red. And in that intervention, you may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful would be less likely to have that kind of attitude. So the story has been to illustrate those 3 levels and suggest that we need to at least address the institutionalized, good to address all the levels at the same time, but at least address the institutionalized racism, and when you do, the other levels may take care of themselves. One more thing on this story, though, which is very important, because there's a question we haven't raised yet. Who's the gardener? After all, the gardener is the one I gave the power to decide, the power to act, and control of resources. Now, government is a huge part of the gardener. You know, that control of power to decide, power to act, control of resources, that's really self-determination, if you will, right? So government is a huge part of the gardener, but not the only part. Media, corporations, foundations, communities, to the extent that they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. When I have slides, I paint her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think, her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. So our challenge is what to do about the gardener. Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions that can come out. I'm going to ask your indulgence for 2 more minutes. Okay, and the 2 minutes of that are, I'm going to share with you, we don't have time right now, we're going to have time later for questions and answers, but these are 2 questions that have stayed with me, that have been asked of me before. The first question was, excuse me, Dr. Jones, but why should the red flowers share their soil? When I heard that question, I loved that question, because it showed me the power of this story to start conversations about racism that are much easier than if we were trying to talk about racism between you and me. My answer to the question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers, it belongs to the whole garden. The other question, though, is what if we're not actually talking about the original gardener, but we're talking about the gardener's great-great-great-great-grandchildren? Here we are. What then? Because those great-great-great-great-grandchildren have grown up seeing the flower boxes looking uneven like they do, and may not even think there's a problem to be solved. So very quickly, 3 parts to the answer. First, we must make the differences in the height and vigor of the pink and red flowers a problem that requires urgent solution. And then as we try to solve, we need to make the flower boxes transparent. We need to be talking about the differences in the quality of the soil. And then as we do that, we have to be absolutely clear that we communicate that pink seed didn't just launch themselves into the poor rocky soil. We need to talk about history. And we need to talk about the gardener's agency in setting up the whole situation. How the gardener's initial preference for red over pink, which some might call cultural racism, what we need to call white supremacist ideology in our setting, how that set up the whole situation, and we need to address that. Because if we do not address that, even if we compel the gardener to enrich the poor rocky soil until it's as rich as the rich fertile soil today, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So I now cede the floor. Thank you very much for listening to my gardener's story.
So David, you know, we don't have flower pots everywhere in Chicago. Just some neighborhoods have the flower pots in the middle. Maybe you can address our Chicago flower pots.
I think the best response after Dr. Jones speaks is silence. So I want to riff on her, the allegories. I want to do open, closed, and play on that. I want to do what's visible and what's invisible. And what do we do? 3 things. Let's see if I can actually do this. So open, closed. So the open, you're in the restaurant, you're open, and the other side is closed. And I want to now give a Chicago version. So everything I know about epidemiology, I learned at the School of Public Health. So thank you. And now I might get graded on this. But this is, you know, I got to Rush and I wrote 2 books. And I wrote 2 books. I was so angry. I worked at County for 17 years. I worked at Mount Sinai for a decade. I was chair of medicine there. Saw things in Lawndale that I couldn't even imagine. And I got to Rush, and I saw Ogden Avenue, one street, 2 worlds, literally a mile apart. And I was outraged. And because I just couldn't yell and scream, I wrote two books. One was, County was about what was it like to go there and the heroics, what we all did to make county work the best we could for our patients. But heroics is not the answer. In the second book, The Death Gap, How Inequality Kills, was about Ogden Avenue and why we've allowed Ogden Avenues. And this, led to discussions within Rush and a presentation to our Board of Trustees, which is the LMAP of Chicago, but this could be any place in America. It could be in LA, it could be in New York, it could be actually any place in the world, but largely this in the American problem. Life expectancy in the Loop is 85. If that was a country, it'd be ranked worst in the world. And if you go 3 stops past where we are right now on the blue line, you land in Garfield Park, or go south 7 stops, it doesn't matter. In Washington Park, your life expectancy plummets to under 69. At 7 stops, it's 6 miles. It's the last time in the United States that life expectancy was under 69. Anyone want to guess? 1950. 7 decades, 7 stops. And when you think about it as a topographical map, you have to say there's a mountain of wealth and advantage in the Loop, and there's a valley of illness and death. And of course, in an audience, when you sort of ask, well, why are people dying early in Garfield Park? Can we name some of the causes here? Pardon? Yeah, in this group you'd say it. Most groups I go to, they say violence. Because our image in our head is people shooting each other, and it is a form of violence, is structural violence. And so naming the root cause, so we don't, with diseases, we don't actually name the root causes. And if something goes wrong in a hospital, that patient has an untoward event, if you don't get to the root cause, you can never fix it. And so we never name the right root causes of this. But I want to do this open and close for a second, because the Loop is closed. Where's the inclusive housing in the Loop? Overlooking Lake Michigan. There isn't any. It's an interesting phenomenon. And then so it's open for the folks in the Loop. But the closed sign, you're sitting in that restaurant, you maybe see the people outside, but actually Garfield Park is invisible. So I want to play on, so it's closed, Loop is open to the folks in the Loop, closed to everyone else. Now who lives in the Loop? Who lives in the Loop? What else is in the Loop? What? Businesses. What kind of businesses? Corporations. Okay, why are the corporations in the Loop and not in Garfield Park? So I wanted to say one thing here. We can't just talk about racism without talking about capitalism. So what is capitalism? It's a system of economic exploitation that has no moral center and is designed to do some pretty fantastic things like this, $1,000 this, which we all have, but it does it the following way: by concentrating capital in the hands of the few, and that's what's downtown, many corporations, and is meant to keep that capital concentrated at the expense of the many. And racism is the engine. Slavery was the engine on which capitalism was built. I just mentioned that because we can't forget that. And while as a system for creating products and doing things, it does a pretty good job, but it does it at the expense of exploitation. And the societies that have regulated capitalism by having social support systems and that, their people do better. We don't. We have a pretty unregulated capitalist system, and it thrives. And so it is even more powerful, I think, than anything else we have going here. And if you look at the international gap in wages and the life expectancy gaps that follow that, is unless we as a society are willing to take that on as citizenry and all the ways we can to mitigate, if you want to eliminate, but to regulate for sure, we're never gonna solve the problem of racism by itself. So I wanted to mention that. That in downtown are lots of white people, and there's a lot of corporations downtown. And many of these corporations now, they're no longer local, they're transnational, and they don't care. They don't care. And so we have to put that on the table. But I want to do the visible, invisible thing, because we all do this. So there's implicit bias. We know what that is. There's explicit racism. We don't need to be explicit anymore. First of all, implicit or explicit, it still feels the same. It's interpersonal. But when we collectively hold ideas about neighborhoods, then we collectively hold, this is from Robert Sampson, The Great American City. And this is actually, he did studies to demonstrate this, that what predicts neighborhood decline, so the future decline of a neighborhood like Garfield Park, are the collectively held images that we have of those neighborhoods. It's not broken windows. So it's not the graffiti, it's not the broken windows that predict neighborhood decline. What predicts future neighborhood decline 10 years from now is our collectively held perceptions, and the things that drive those perceptions are the race of the people in the neighborhood. So if you're black and brown, or if you're immigrants, that predicts neighborhood decline more than broken windows or graffiti. So if you go to the tourism map of Chicago, go try this out tonight, and try to pick something up on Garfield Park, nothing shows up. So not only have we contributed to it, not only is there interpersonal racism and there's unconscious bias, but collectively, all of us have made these neighborhoods invisible. So I wanted a little test in this room. Raise your hand if you've been in the loop in the last 6 months. Raise your hand. Okay, look around just for a second. All the hands are up. Okay, hands down. Raise your hand if you've been in Garfield Park in the last 6 months. Oh my God, that's fantastic. Okay, we have to, so we must show up in these neighborhoods, because the continuing crime of invisibility is destructive. And then when people are not seen, that just reinforces this negative cycle. So I want to just say this last point here. Who we need to name racism. One of my colleagues, Dr. Boyd, Camara Jones, said, well, who else is going to say it? So it's really an obligation of white men in this room to figure out how you're going to bring this how you're going to have this conversation. How you're going to name racism. How you're going to leverage your privilege that you carry with you to fight this. Because until we begin to speak about it, not ones and twosies. See Dr. David down there, he's been, for as long as I've known him, speaking about this. There are too few white men who speak on the subject. And then I want to talk a little bit about, we can talk about these allegories, we can talk about big things like life expectancy, and my God, they're hard to figure out how to do it. We have to ask the question, how is it working here today? And by here I mean the School of Public Health. By here I mean Rush. By here I mean our institutions. Because we are actually perpetuating historic injustices in our midst. And we're doing it every day at county. We're doing it every day. And we've got to put our own houses in order. I'll give you an example from Rush. We looked at these 9 West Side communities with life expectancy gaps, 500,000 people, and we said we need to do something intentionally different in these neighborhoods. But then we said, let's make our own employees the first neighborhood. And we began to dive into our employees' experiences. And of course, if you put the equity lens on, who's thriving and who's not thriving, or how does it actually work here? I do this like an old viewfinder when you click. So when I'm talking about racism and people start to glaze over, mostly the white people in the room, but to get them to understand, we have to say is, how does it actually work here? So I put on the viewfinder and say, how does it work at Rush? How do our policies at Rush work that perpetuate historic injustices that have white on top, brown and black on the bottom, men on top, women on the bottom, the wealthy or those who are richer on the top, the poor on the bottom, and you can go on and on. And so you can take any policy. So how does our policy towards pension, who generates wealth, perpetuate historic injustices? So you can look at all your institutions. So we looked at Rush. So it turns out we have a fantastic policy. It means if you put 3% away, Rush puts 1.5%, matches. It's a 403B plan. And if you put 6% away, Rush gives you 3%. So you look at all of our employees at Rush. There are a small group of people, about 5%, maybe not that small, who take money out of their pension because of hardship. So now you line up the Loop and Garfield Park, just for the sake of this. So if you work at Rush and you live in the Loop, you're likely to be white, you're likely to be a white man, probably a professional. You're putting 6% away, Rush is giving you 3%, and you never take any money out. But if you live in Garfield Park, you're likely to be black, you're likely to be a woman, you're more likely to be putting 3% away than 6% away. Rush is matching 1.5%. And if you live in Garfield Park, almost 1 out of 5 takes money out of their pension for hardship. And the hardship is evictions and rents. So until we looked at this, we were perpetuating historical injustices. And the solution is to raise the wages. And where we said, what's the inflection point? So you think living wage, $15? No. These people are making more than $15. When you get the inflection point when people aren't forced to take money out of their pension, they're black and brown people, it's about $25. And so we're adjusting our pension, but going to the leadership at Rush says money has to go to raise the wage of our lowest workers. Now, I don't know if I'll be successful with this, but think about this. This is how racism kills people within our own institutions. These are people we see every day, so I think we have to bring it home, but that's not enough. We need, I like to talk about reparations. So first of all, slavery and why we talk about slavery. So I'm Jewish. Every year we have this holiday called Passover, where we remember being slaves in Egypt. That was like 3,000 years ago. So if people are talking about slavery 400, go for it. We need to be, right? But by the way, until very recently, this was all legal, and now we have paralegal systems that perpetuate forms of slavery. First of all, if you're making under $15 an hour, you are a slave, no matter who you are. So that needs to be mentioned. 2, reparations. We need to repair. And if it's not us, so I like to talk about Chicago. You can talk about Trump all you want. This problem in Chicago has been here forever. It was worse. 1. 2, it's not about Rauner in the state. It's always been local, and it's always been Democrats. So we think the Democrats are our friends, right? I'm just saying, this is local. This is our problem. And by God, the institutions have to lead it. We don't need to study it. We need to lead it. And that's a further conversation. And there, I got to say, maybe the last thing I'll say, urgency, urgency. First of all, you all got to talk about racism, but that's not enough. Children are dying as a result of our inaction, of our inability to get it right. And I don't know, Linda, between you and me in Chicago, we've been here like 100 years, you know? And there's an urgency. These are not, when people say disparity, like difference in heights, okay, different in weight, these are injustices. So it's important for all of us in this room. So when I describe myself, I'm a doctor, I'm a health activist, I'm a social justice activist, and we all need to be activists. You need to feel uncomfortable, I feel uncomfortable, we all have to do this together. Shame on us for not getting it right. So I'm done there. Linda, jump in.
I'm not going to give a long speech, but I want to try to set a context because I don't want just the audience to ask questions. Most of you are alumni or students, and many, many more are alumni of other institutions. We care about healthcare. And so one of my big concerns is, what are we doing at this school and all the other schools about this? Do we lie to the young? I think we do. We have nice little graphs and eco-social models, but we're not really serious. You know, we don't really explain that the structural determinants of health determine health. It's not like, oh, some people are poor and we need to give them a little bit more money or something. No, it's built into the structure. And the battles that go on every day. And public health has not always played a good role. When we join with social movements, I think we add to the solutions and make progress, but frequently we don't. So the legislation in 1996, I think that was the year, that the Congress put that rider on that the CDC could not do research that promoted gun control, which is not the same as saying you can't research violence and gun violence. That's some self-censorship nonsense, okay? How can we talk about the health of communities when we didn't speak up when the school system was put under a finance authority? That's an attack right on people's health. It's predictable if you shut off recess and intramural volleyball and sports and music that you're going to produce a type 2 diabetic epidemic in our young. I'm so old that when I was in medical school, type 2 didn't exist. It was like adult onset and juvenile diabetes. You never ever saw type 2 in young people. So this is a disease that we have structurally, socially created. So my challenge as we begin this conversation is, what are we not doing? It starts here in the school. I see Brother Stovall there in the back, our expert education person in the house. How do we organize so that we produce the insanity that we have now? Because it's not accidental. What is the man been doing since the end of World War II to put us where we are today? And how have we not kept up with what's going on? We're like fighting the battle of 1950, missing the stuff that's being changed. So that's really my concern as I sit here and say, didn't we talk about this before, like 30 years ago or 25? You know, I can't even keep track of all the things. Every public school in West Virginia is closed. That's what we need. Every single one, because those teachers are on strike for a decent standard of living and decent health care. Why aren't we teaching our public health students how to organize that? Do we have a course that explains the role of labor and labor unions? Do we ever talk about the fact that the loss of organized labor membership in this country is part of the reason we have the poor health outcomes? If I hear another person tell me about a bicycle path in my neighborhood, I'll scream. So what are we doing, or more importantly, what are we not doing? How can we address the curriculum of the school? Where's our course on racism? It's not where it needs to be. We need an actual course, not some faculty that are not that well trained mumbling about race. That's not what we need. And we got people that on the East Campus that know how to teach this stuff. Have them come over here. I don't think that's allowed. I don't know how they don't do that. When did quantitative methods be the only thing? Where are our historical methods, our anthropological methods? You can't understand. I mean, I know, Camara's tried to do work, because she's a trained epidemiologist, on trying to how to measure racism. Maybe our surveys aren't the best way to measure racism, okay? Don't get so caught up in, I mean, we can have nice methodological debates, I like having those, but that's not really where we need to be. We need to try to give our students, all of our healthcare students, some understanding of the history of the city, the history of the country and the world, what really determines health, and act like we mean it. Just because we can't do nothing about it doesn't mean we can't name it, okay? Act like we mean it, like we really believe what makes people sick. And that means getting out of our health silos, not partner. I said the thing I don't like, partner. I don't know about that word. It means joining with other folks that are concerned about issues and fighting with them to change the system, capitalism and racism. Don't just throw around neoliberal if you don't know what it means. And let me just say something. Young folks, you got to read. You can't be anti-capitalist and then whisper in my ear, well, what is capitalism? It's hidden there in the library. But read about it, okay? And understand that the demands that are on the lips of youth now have been there. You don't know how sad I feel when I hear my grandchildren talk about Black Lives Matter, and I'm sitting up here saying, Mildred, didn't we, what? And the bad thing is, when we were young, the old people said, we did this before. We have a history of struggle in this country we don't know or understand. And when we come together and bring those struggles together, we can make progress. So let me ask you all, what are we going to do? And of course, you could use the mic and make your comments and ask questions. So you just line up there. And I'm gonna ask a question of Dr. Stoll. I'm gonna ask him, what the hell happened to the education? What's going on with the kids in the school?
Well, peace and greetings, everybody. My name is Dave Stovall. I'm one of those folks on the East Campus that actually talk about race. And for folks who haven't heard this, yesterday, Chicago Public Schools decided to close 4 schools in Englewood, which is an area just like Garfield Park. And the thing that is not discussed about Englewood has actually lost population, right? So it's devoid of young people, right? The city of Chicago has lost 240,000 Black folks in the past 15 years, right? So now when we talk about that, so when we see a depopulated school that's rationalized to be underutilized, we now only have to look at the structure. How does a school become underutilized, right? You dispossess it. You take all the resources from it, and then you blame the young folks that are there for its failure, right? So this thing around, so now what we're seeing, and this second part, and I think this is important for folks in public health, when you look at and let's just use Englewood as an example, the political ploy by the mayor is to build a school where no young people are. So now this thing, and so now in the public eye saying, well, this is a great thing, right? You're building this school, but there are no young people there, right? So who's gonna go to that school, right? Who's gonna have access to it? But the real question is, will that school ever get built, right? And I think this is where, so when we talk about school spaces, look no further, right? Because here in Chicago, and folks have laid this out, the #1 determinant for family purchasing a home is the school that it's in proximity to. So when you look at new residents in Chicago, all you have to see is what school they're in proximity to, right? And for some people who are unfamiliar with what's happened at National Teachers Academy, which is a school right here on Cermak and Federal that was doing right by black youth, right? So they decide to close it. Now, the understory is they're rich white families that Doc mentioned that live in the South Loop whose kids couldn't get into Jones, right? Because now here in Chicago, you have an apartheid system, right? So selective enrollment schools, it's easier to become a freshman at Harvard than to get into selective enrollment schools here in Chicago, right? So now those white families couldn't get into Jones and actually moved into that community with the idea that they would get into Jones. So now because they couldn't get into Jones, they usurped a 40-year struggle in Chinatown to now say we need a neighborhood school, right? So all of this stuff, we always have to pay attention to the layers. It is not a singular story, right? And when we look at those particular layers, now what people are starting to talk about, and this thing that we can do in real time, 2019 is upon us, right? And dude does not have to be there. I know, I mean, that is super simple, right? And the other thing that comes out when you talk about health disparities, the other thing that comes out, whoever that new person is can do two things instantaneously. They can push for a locally elected school board, right? The second thing that they can push for is a community-based police accountability structure. Right? So this thing, right? And that can be done instantaneously, right? That's the right now, right? So this thing around how we look at this, because if we get more of the same, and I'll end on this point, if you all think about the city of Chicago, if you think from 79th Street to 135th, from Halsted to the lake, there are only 2 neighborhood high schools that are near capacity, right? 2. So now when we think about those particular spaces and what's been devoid, so we now have communities that do not have neighborhood high schools, right? And the question becomes not what is the problem, but literally, how did we get here? Right? And those structures, because a school that doesn't have a library, that doesn't have a librarian, that doesn't have art, that doesn't have all the things that it needs to be a quality school, is not a failing school. It is a school intended exactly what it was intended to do under the structures of racism and white supremacy. So this thing around, so now when we look at that spaces, these are the things that are possible. So if, as the organizers tell me, if 2019 goes the same way, it's on us. Those 2 schools are Simeon.
Go to the mic, please.
Oh, sorry. Right. Those 2 schools are Simeon and then not the V, because the V is actually deeply underpopulated. It's Simeon and South Shore. Yeah, so those are the 2, and actually South Shore is outside that boundary because it's on 76, right? So this thing around, so those 2 schools are the ones that are still at capacity.
Other comments, questions? We're ready to sign your petitions, son.
While we're waiting for other people to come up to the mic, may I just throw out something else that might stimulate? Because when you started talking about like a citizen review board, I have been, I talked about the importance of us figuring out how is racism operating here, like what are those points of leverage where we're going to go. So I just wanted to share this schema. I think that the mechanisms of institutionalized racism and all of our systems of structured inequity are in our structures, policies, practices, norms, and values, where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And so, first of all, if you ever find yourself at a decision-making table, you need to look around and say, who is not here, who has an interest in this proceeding, and then not just represent their interests, but find them a way to the table. If structures are the who, what, when, and where of decision-making, policies are the written how, practices and norms are the unwritten how, and values are the why. I bring this up because if you take that question, how's racism operating here, you could say, well, how is racism operating here in terms of police killings of unarmed black and brown men and women? Well, a structure would be the presence or absence of a citizen review board to monitor police activity. A policy might be requiring a grand jury to bring an indictment against a police officer, as opposed to like, oh, well, the police officer shot the gun, the person's dead, so you know, there's a basis for charging, right? A practice might be the over-policing of communities of color, which might cause more accidental interaction, if you will. A norm might be the blue code of silence, right? If a police officer sees something wrong and doesn't say anything. A value would be kind of that societal view of black men as inherently dangerous, so that a police feeling threatened, you know, has a legitimate, if you will, claim to fire their firearm. So even in that thought exercise, thinking about the who, what, when, where, how, and why of decision-making on that one question has given us 5 possible points of intervention. You can't just pick one. You can pick one with a group, but other people have to be picking others at the same time, because we have to try to dismantle this stuff, not one little strategy at a time. Everybody needs to take a piece of this, because racism is a morphing, smart, self-preserving system, right? But we each do need to take some piece. You can't just be sitting back waiting for somebody else to do this. And you can't be feeling like, oh, what can I do as an individual? I can't undo racism. I can't dismantle racism as an individual. Yeah, you know, you probably can't. So we need to organize and strategize to act.
Now, we want to respect people's time, but we have till 7:30. We have another 15 minutes or so, so please come. You have a loud voice, you can shout. We prefer you come to the mic and make your points or ask your questions. Yes, ma'am.
Just to follow up what you said about the police. Sorry. I would think that we would need to change the laws and not allow for police officers to hide behind the "I was afraid" or "I fear for my life." So when a young man is running away from you with a knife or a gun, shooting them in the back is not something that you're afraid of your life, because clearly your life was not in danger if he's running away from you. Also, your analogy about the pink and the red flowers, what if the gardener was pink? How would you internalize that? And then there was also one more thing, sorry, to follow up what he said about the schools. I drove past Sweetness' school, and that's Walter Payton's school. Same environment, same systematic removal of concentrated poverty from that area, Gold Coast area, to the suburbs. And now that school also has the use of TIF funds, and that school also is, I believe, is selective enrollment, and it's not educating our young black youth that once populated that area.
Hello, great talks. I am a student at the College of Dentistry, actually, and hearing about the analogy with the gardener and invisible communities, I think a lot how a lot of this applies to dentistry, because even compared to healthcare, we don't view dental care as necessarily something that everyone is fundamentally entitled to. And in dentistry, there's huge disparity over what populations dentists are willing to treat based on their insurer, and public aid discriminates against people who are on that insurance system, since it reimburses much lower. And typically, as dentists are individual practitioners or work in a small group, they're more cognizant about what communities they're able to practice in, or what kinds of insurance and payment systems they're willing to accept. And even people's oral health care is dramatically influenced by the foods that they have access to, which is dependent on the communities that they live in, their level of healthcare literacy, their ability to just have a toothbrush and toothpaste to brush their teeth in the morning. So it's something that I understand there's a need for, and there's a lot of individuals that have issues here. But as an individual practitioner, someone who's going into this field, you can be a crusader and, you know, work at a Medicaid or a community healthcare clinic in an underserved part of town. But is there another way for any healthcare provider in any field to have a greater impact within their field than just being kind of a lone crusader or working in a community clinic?
We should listen to all the questions and I think write down answers and then answer, because sometimes the questions are more important than the answers. So we need to hear all the questions and write down our responses.
Hi, my name is Maya. Thank you so much for speaking. I'm part of Anakbay in Chicago, which is a progressive Filipino youth and student organization. And one thing you were talking about when you're talking about the closed and open door was about international issues. And I think that that's something really important to me, especially thinking of our community. 1 in 4 Filipinos are undocumented in this country, and many of them are labor trafficking victims that are evacuating our homeland because over 14,000 people have been killed in the war on drugs under the U.S. Duterte regime. And so thinking about their labor and the fact that many of them are caregivers, are oil rig workers, are working in hotel and restaurants, but their labor is really invisibilized, right? How do we talk about these global and public health issues? How do we uplift these invisibilized labors in our community, especially knowing how grave the situation is, and also how our U.S. taxpayers' dollars are going to fund wars in other countries that are forcing them to evacuate in the first place. It's a 152 million U.S. taxpayers' dollars that's going towards the U.S. Duterte regime, which is killing our people. So how do we uplift that struggle as well?
Hi there, my name is Bonnie. I'm a social worker from Rush down the street. My question is relating to Dr. Ansell, what you were saying about white supremacist capitalism. How do we make investing in healthcare and, of course, in education and job creation as profitable from a return on investment standpoint as it is to invest in for-profit prisons, the military-industrial complex, and big pharma?
Hi, my name is Kendall. I actually work for the Lake County Health Department in the HIV care and prevention program as a health educator. I mean, obviously, HIV positive populations are extremely disproportionately people of color and Spanish-speaking individuals. And I just kind of wanted to speak on my educational background moving into this field and kind of answering the how do we prepare our students to better handle injustice. And I double majored, I don't have an undergrad in public health. I doubled in applied health and women's gender sexuality studies, which I like to say I majored in social justice with a minor in feminism. But I think that background of having both the hard sciences and an arts degree has really prepared me well for approaching health from a social justice perspective, and it has given me a lot of background info that not everybody has coming from a public health background all the time. So that's just something to keep in mind, I think, is to seek out other kinds of educational opportunities to balance out the hard sciences of public health. So.
Thank you all for your time. Some familiar faces. My name is Monica Garcia Norlander. I'm with the Center for Health Equity Research Chicago, right here out of the University of Illinois Chicago School of Public Health, and also UIC, the UI Cancer Center. My question is for Dr. Ansell. Hag Sameach, Happy Purim. What is the tipping point to get more white men to help us dismantle these systems? What does it take? Thank you.
Hi, my name is Richard Shaw. I'm actually finishing my master's in public health at Chicago State. I've known Dr. Murray for several years now, since I've been here in Chicago. I came here from Washington and I actually grew up in West Virginia. And I love the allegory having to deal with the red flowers being in good potting soil and the pink flowers being in the bad potting soil. But growing up in West Virginia, I got to see a whole lot of red flowers that were in really, really bad potting soil. And the funny thing about them is that the results with them were the same as the ones in the pink potting soil, but they always could look at the red ones that were in good soil and say, well, at least not pink. I wanted to just add that layer to the story that you were giving there so we could get some thought on that, exchange on it. Thank you.
Thanks. Is there somebody else coming?
Coming to the mic, or? I am. Okay, we'll take a couple more, yeah. We'll take these last two.
I just want to sneak something that builds on that. How do we, as we start to see people pay attention to like unprecedented declines in white mortality, how do we resist framing, just always measuring health against the white standard and what that makes invisible?
Hi, my name is Aubrey. I'm a school nurse in Madison, so I'm not super local anymore, but when we were talking about the schools and the particular schools that do shut down or aren't supported, and it's usually because they're proven that they're not successful, and it's this cycle, right? So there's a program called ESPERT. It's about motivational interviewing in the school. And the nurse was nominated to do it, so I went and I started learning about it. And they were really pushing us to start implementing it in the schools. And then last week I found out that they're gonna implement it in 4 schools. And Madison has tons of schools, middle schools, high schools, elementary schools. And Cherokee, my school, which is known as like a rough school in Madison, more than half of our population is African American, and most of those students are also low socioeconomic status. So I consider my school to be high needs, but our school is not gonna be implementing ESPERT because we're not showing that it's working, but we don't have the tools to make it work. So it's this like continual cycle. So how do you break it? How do I was arguing with the head of the mental health services in Madison, and I said, we need it. That's why it's not working, is because we need more people to implement. So I really want to know how to push for that and how to break that cycle of not saying the good schools are good because and then adding more resources to those. We're not offering the resources to the schools that actually need them because they're not proving themselves yet. So how do we do that? How can I do that? Just as a school nurse in the whole Madison district, I want to know how to make a difference. So.
All right, so we're going to solve all these problems.
You want to go first?
Yeah, I'll just. Wow, that's a lot. But I wanted to say, first of all, the arc of history, we hope is going to move us in the right direction. So I think we have to be able to say that happened. It only happens if we're willing to do the work to seize power. And through the means that are possible for us to do that, because this is about power and the rules that are made around power. And so I just want to state that as so critical, and these things start at local, or they go to national. So we have to be, and we must be political. We must all be political, that's number one, and not shy away from being political. And number two I want to say is narrative is critically important, but narrative plus data plus action. We have to be able to look at our practice. So I say, I practice in an office, I practice in a hospital, but you have to be willing to practice social medicine, social public health, by going out on the streets, by demonstrating, by speaking, in all kinds of ways. And if you look in Chicago, local things, positive trauma, a trauma center on the south side, victory that occurred because our young people led and were relentless about doing that. Now, does that solve the underlying problem of racism? No, it doesn't. But I'm going to say those 3 things are critically important steps. And not only do we need more white men to speak about racism, and we just got to get out there and speak about it, we need more public health folks who are willing to say they're going to take their beliefs and be active about it. See it, say it, and be willing to do that publicly and collectively, because that's how change will not occur by writing papers. I can guarantee you that. And change will not occur because you get an A on an epi exam. Change will occur when there's a social movement that is that's going to create change. And everyone in this room has the opportunity to be a leader in this, and because you see it through your work, and we see it through our work. So that was my commentary on all of this.
So I made notes on a lot of them, but I think I'm going to start with the two that were about the gardener's tale. I was asked, what if the gardener is pink? And so that's a very important question. It doesn't matter what color the gardener is, it's the preference that the gardener has for red over pink, and the kind of inaction in the face of need of leaving the structural barriers there without attending to them. So there very well might be some pink gardeners who have been indoctrinated and still value red over pink. We see that a lot. Or there might be red gardeners who are so afraid they're trying to get up to the next level of gardening that they don't want to, rock the boat. And so very often there are people who don't recognize the power that they have, even if they're pink, to hire a student or to change an agenda item or to speak up. So we all need to recognize our power wherever we are, even as we're trying to get to the next level. And then thank you for the question about the red seed that find themselves in the poor rocky soil, because we are hearing from them a lot right now. And they believe that the red gardener cares about them, but that red gardener doesn't care about them, right? But so it is a thing, and they blame the pink seed for the poorness and rockiness of the soil, right? And they feel entitled to be in the rich, fertile soil because they think of it as the red soil, so it causes lots of problems. And you would think that the red seed in the poor rocky soil would join with the pink seed in the poor rocky soil, especially because they have a little bit of a more of an in with the gardener to join together to try to do something about the soil. But instead, the gardener, by proclaiming the benefit of redness, even though they're not trying to help that red seed, have divided the pink and the red seed, all of them in the poor rocky soil, the same way they divided black folks and white folks in labor unions. They divided the sharecroppers, the black from the white. When people have this common interest, racism has been used time and time again to divide people from each other when they have common interests in support of, we've been talking about capitalism and all. My definition of capitalism, by the way, which is very naive, is some people own the means of production and other people work there. You know what I'm saying? And it's about exploitation there. I wanted to say a few more things which address some of the questions. I wanted to say that as we're trying to move toward dismantling racism and other systems of structured inequity, there are three huge societal barriers that we're facing. One is that in this country we have a very narrow focus on the individual, which makes systems and structures either invisible or appear to be irrelevant. So we're more interested in getting inside the individual and studying the genome than addressing schools, housing, the justice and injustice system, immigration, or these other structural factors that are obviously having detrimental impacts on our health. The second is that we as a nation are ahistorical. We act as if the present were completely disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. So we need to bring history back into our knowledge base, as Dr. Murray was doing when she even opened our session. We need to, if you're ever in a decision-making table trying to solve a problem, you should ask, how did this problem come to be this way? That will give you a lot more insight on how to untangle that. And the third barrier, first is that we have a narrow focus on the individual. Second is that we're ahistorical. The third is that we endorse this myth of meritocracy, the story that goes something like this: if you work hard, you'll make it. Now, I will give you that many people who have made it have worked hard. Most people, maybe. Not everybody who's made it has worked hard, but I'll give you that. But there are many, many, many other people working just as hard or harder who will never make it because of an uneven playing field, which has been created and perpetuated perpetuated by racism and other systems of structured inequity. So we have to name racism and these other systems of structured inequity, sexism, heterosexism, capitalism, like, we need to name those things in order to, if we don't, then we're complicit with the myth of meritocracy. If we deny racism, which you can do two ways, you can say, I don't think racism exists, that's one way of denying racism, or never saying the word racism is another way of denying racism when there's a widespread denial in the society that racism continues to exist. When we deny racism, then we are supporting that myth of meritocracy that blames people for their situations and doesn't feel like there's any investment needed. And when we do investment, we have to get beyond short term. You know, politicians are thinking about the next election. Funders often have 3-year or 5-year time frames for their work. We need to demand 20-year investments, 20-year sustained investments in communities, generational investments. Because if you add a little bit of fertilizer to the soil right now, maybe the flowers that are there might grow a little bit more, but it's the seed that falls into that enriched soil that will really show the benefit. We have to understand that and demand that we make sustained long investments in communities. I also wanted to just to give you a tool, and I know I've missed many of the questions, but I wanted to say this. How many in this room have ever heard of the International Convention on the Elimination of All Forms of Racial Discrimination, ICERD? So a few of us. Oh, this is more than usual. What is the International Convention on the Elimination of All Forms of Racial Discrimination? It's an international anti-racism treaty that was voted by the UN General Assembly in 1965. Who even knew there was an international anti-racism treaty, right? Okay, do you think the US signed this treaty? But surprise, surprise, we did in 1966. But the trick there is that the Senate has to ratify a treaty in order for it to have effect. Do you think the US Senate ratified this treaty? Yes, they did. 28 years later, in 1994, what it means is that today we have international treaty obligations to do right under this 9-page treaty. One of the obligations is to submit periodic reports. The State Department submits a report every 6 years. This is real stuff. You can Google ICERD, right? And then when they submit a report, anybody else can submit a report who wants to, a parallel, a shadow, or alternative report. So the last time we submitted our report in 2013, there were 84 parallel reports. The committee reads all of those. Then they send back their concluding observations. We got our last concluding observations in 2014, only 14 pages. It's not a telephone book. We can all read that this weekend, right? And it starts out, Dear United States, thank you for your report. We remain concerned about disproportionate incarceration, residential segregation, the achievement gap in education, differential access to health care, on and on and on. And not only do they remain concerned about, they have specific recommendations that we are kind of treaty bound to address. So this is a tool for community organizing that we need to familiarize ourselves with. So ICERD. So I'm sorry I didn't get to answers for the other questions, but I'm going to let Dr. Murray go.
I want to thank everyone for coming today, and I only have one thing to say as we close. Don't get psyched out by these motherfuckers. They came here, they tried to wipe out our indigenous populations. The Native Americans are still here kicking, okay? They moved the border of Mexico. They lynched just as many Mexicans as blacks during the same decades in the same proportions. Latinx people are still here and they're kicking it. We ended chattel slavery. That was not easy. So don't let these people psych you out. What we're talking about here, we can do. It won't be easy. I'm not sure how long it will take us, but we can dismantle capitalism and racism. And if we don't, our great-grandchildren will be cursing our names. So go forward, keep up the good fight, and thank you for coming tonight.